Good morning, ladies and gentlemen, and a special good morning to the members of our virtual head table. Professor Donald Simeon, Director of the Caribbean Center for Health Systems Research and Development and Chair of the conference proceedings. Dr. Paul Edwards, Advisor, Health Systems and Services, PAHO WHO, Trinidad and Tobago and the Netherlands Antilles, and a strong supporter of public health care in the Caribbean. Councillor Tracy Davidson Celestin, Secretary of Health, Wellness and Family Development, Tobago House of Assembly. Professor John Lavis, Professor of Public Health at McMaster University. Professor Lavis is also a member of the advisory board of the center, and he's a great international contributor to the global public health movement. Our tireless Minister of Health, the Honorable Terence Singh. Minister, I do not know how you do it, but no matter the stressors, and I know that there are many, you always appear on the daily press conferences so relaxed and calm. A most admirable quality, sir. I would like to recognize some of our faculty here. Professor Chidam Ezinwaka, Deputy Dean Basic Health Sciences and Professor of Chemical Pathology. Dr. Sandra Reed, Deputy Dean Clinical and Senior Lecturer in Psychiatry. Dr. Kenneth Charles, Deputy Dean for Graduate Studies and Research and Senior Lecturer in Hematology. Professor Jimmy Ramdas, Deputy Dean Outreach and Professor of Vascular Surgery, and Dr. Bidya Saar, Deputy Dean, Academic Quality and Accreditation and Head of our Center for Medical Sciences Education. Our heads of department I also recognize, and other academics, but including Professor Aura, Professor Akpaka, and Ms. Marsha Ivy, our Faculty Public Relations Officer, who all supported this conference wholeheartedly. I must also recognize the work of Professor Simeon, a truly gifted academic leader, whose idea this event was. Professor Simeon is chair of the research subcommittee of the cabinet-appointed Senior Joint Planning Committee, a committee which oversees the work of the Faculty of Medical Sciences within the regional health authorities in Trinidad and Tobago. This committee met for the first time around 2016, and the subcommittees were appointed then. We are pleased that the Ministry of Health and the Tobago House of Assembly have continued their unwavering support for this event, which they expressed from the very first meeting. I want to say that each of the health authorities has played an important role in supporting this, the first national conference of its kind in our land. But in particular, I must recognize the contributions of our colleagues from the University of the Southern Caribbean, Professor Chand, Professor Clark, Ms. Woodford, and the University of Trinidad and Tobago, Dr. Rogers. This conference was originally carded for late March 2020, but had to be postponed because of the COVID-19 pandemic after about 1 year of planning. Not surprisingly, we commenced with a session on COVID-19 led by the renowned Professor Christine Carrington, head of the Department of Preclinical Sciences. There is an important session on mental health on day 2, which commences with a feature address by leading psychiatrist Professor Gerard Hutchinson, who has done some in-depth work on psychosis and depression here in the Caribbean, in London, and Nigeria, and India. Day 2 closes with a session on innovations in health and our sister universities that look at 3D printable prostheses from Dr. Rogers and a new approach to health-seeking behavior in Trinidad and Tobago from Professor Chan. The Faculty of Medical Sciences has had research days for its students and periodically for its academics. The regional health authorities also have annual research days, but this year's achievement reminds me of a wish once expressed by our founding father, Dr. Eric Williams. It is my understanding that he pushed hard for a medical school here at St. Augustine because he felt that Jamaica alone was benefiting from research into health. He wanted research into healthcare here in Trinidad and Tobago as a means of improving our own healthcare system. Today we have taken a huge step in that direction, and I hope that this conference will become an annual event. This National Research Day has provided a forum for researchers to share their health research findings across the country, and so will foster collaboration across all universities in Trinidad and Tobago. During this conference, we will honor Professor David Piku, who is a former director of the Tropical Metabolism and Research Unit at the Mona campus, and he came to St. Augustine in Trinidad and Tobago when the 5-year medical school at Mount Hope was opened, and in fact, he was chair of the task force that created the Mount Hope Medical Complex. David was a great researcher, and his research into severe malnutrition right here at the University of the West Indies contributed to saving millions of lives globally. He will be awarded the inaugural Lifetime Achievement Award later in this meeting for his remarkable contributions. Thus, today is also an opportunity to celebrate health research achievements in Trinidad and Tobago. And I think that if Dr. Eric Williams were alive today, in spite of this COVID pandemic, he would be celebrating with us as well. In closing, I must express our profound thanks to the live wire of the center, Ms. Shelly Ann Hunt, who it seems became the kingpin of this event. Well done, Shelly Ann. I know she has been ably supported by Kershel Barker and Nikisha Headley, and we acknowledge all of them. Ladies and gentlemen, on behalf of the Faculty of Medical Sciences of the University of the West Indies, I want to welcome each and every one of you today and to hope that you have an enjoyable 2 days at this national meeting. Thank you.